All in all, the uninsured face little or no excess mortality risk. That's what the science says. Let's leave wishful thinking to the side. And even if the purported excess risk is comparable to, even if that purported risk is 22%, that's comparable to other everyday risks that lots of people face, and we don't declare there's a big crisis and we got to intervene to protect those people. And if we're going to spend $1 trillion+ on providing health insurance coverage, we could actually, for the same resources, save 8 times as many lives. So there's much more cost-effective ways of using other people's money to pay for stuff. The premiums that are needed to avoid various financial risks facing the uninsured are way, way, way below the actual costs that Obamacare is going to impose to solve this problem. And moreover, the willingness to pay to avoid all these financial risks also is way below the cost of Obamacare. So Obamacare either is tagging taxpayers to pay this horrific cost, or they're using the individual mandate to try to force the uninsured to pay a cost that's way above their willingness to pay. It really doesn't make logical policy sense. And even if you take into account all this cost shifting, either to private payers or to taxpayers, or the combination, what we're doing to solve under Obamacare costs way more than those shifted costs. So you're going to end up paying way more if you try to solve the problem at the front end than if you just resign yourselves to here's a cost that's in the system, like uninsured motorists, like shoplifting at retail stores. You know, it's a pretty small percentage in the grand scheme of things. So I'm hoping that we reform the health reform that was passed in 2010. I personally favor repeal and replace, but it doesn't matter whether you think you can somehow mend Obamacare or just repeal and replace it. I'm hoping that in the future policymakers are more diligent about trying to figure out what the problem is they're trying to solve and coming up with a solution that's commensurate with the size of that problem.